Welcome to this video where we will continue our study of the blood vessels. Now we are shifting our focus on more of the physiological aspects of these. First, we will talk a little about the pulse and then dive in on a greater detail to the blood pressure, especially its regulation and issues with it. So, let's get started. First, I want us to look at some definitions. And I think that we are all familiar with the concept of flow and then applying it to the blood flow. So this is measured as an amount in a given time. But what I am especially interested in is defining the concept of blood pressure. So, if I ask you in an assignment to provide a definition, what would you say as for what blood pressure is? Well, the key here is that blood pressure is a measure of the force that blood exerts against the blood vessel walls from inside the vessel. And we measure the blood pressure as millimeters of mercury. So, what is a normal blood pressure? Well, the values range a little bit and get redefined every now and then, but somewhere around 120/80 milligrams of mercury. Some accept anywhere between 90 to 120 for the higher and 60 to 80 for the lower values. It depends a bit. But what are these two different numbers? Why do we get two values for the blood pressure? Well, these are our systolic and diastolic values. And as you remember, systolic referred to the time during contraction of the heart. So here, the blood is squeezed out of the heart with a great force. Remember the concept of high blood pressure and pulsatile fluctuation from our earlier video. So the arteries are adapted to this high force, and it is what we measure here as the first number. And diastolic was during the relaxation of the heart, as now ventricles are refilling. As a result, the pressure in the blood vessels, in arteries in this case in particular, is lesser. So that gives us the lower value. As an interesting note, please spot that it is during the diastole during which the coronary arteries supply the heart muscle itself with blood. So, what affects blood pressure? Well, I have picked four that I want to discuss here. The amount of total volume of blood plays a role for sure. Also, the blood pressure is a sum of cardiac output multiplied by the resistance to the blood flow. So that gives us this nice formula that we may have seen before. And finally, we should note that the role of how well blood flows in the vessels and how elastic the vessels are. Another concept that I want to mention here is the so-called white coat syndrome. This refers to the fact that many of us show an elevated blood pressure when it is measured at the doctor's office. This can be attributed to the stress or anxiety or nerves during the seeing a MD or a nurse. So you really should monitor blood pressure at home in a comfortable and safe environment where you feel relaxed. That would likely give a more accurate result. So, I also wanted to mention the concept of a pulse. So, this is sometimes also known as the heart rate. So, this tells us the number of times that the heart has beaten in a minute. And we should consider just for a second that what causes this pulse-style beat that we can feel from the pulse points. And for that, I have a nice diagram for us to use. See here how the top line shows the systolic pressure and the bottom line the diastolic pressure. We will notice how there is a lot of fluctuation between these closer we are to the heart, at aorta and arteries. So when we take a pulse, we are looking for this fluctuation to be able to tell when the heart has beaten. And an important message here to note is that the pulse is always taken from the arteries for this reason. The pressure fluctuation disappears at the capillaries and after them. So, where could we measure the pulse from? Taking a pulse is one of the things that the nurses or healthcare assistants always want to do when you go to the doctor. This is considered as one of your vital signs, in addition to the blood pressure, respiratory rate, and body temperature. The locations where these are taken are usually places where the arteries run closest to the surface of the body, so are easily accessible for us to record these from. So the most common place to take pulse is from the wrist. This radial pulse is used perhaps most routinely, but it is by no means the only place where you can get a pulse from. Let's see some others. So, from the neck, the carotid pulse. From wrist, we can do also ulnar pulse. From cubital fossa, the brachial pulse. From legs, the popliteal pulse. From feet, posterior tibial or dorsal pedis pulse. From groin, femoral pulse. From temporal area of your head, superior temporal pulse, or you can also do external maxillary pulse. The big thing with these, I guess, is that we should always try to measure these from the same places if we are keeping a record of possible changes. And it is important for us to know what is typical pulse for that particular patient. This is why we try to collect these every time you go to see a doctor or medical professional, so that we have a record of these. So the next thing that I want us to talk about is the ways how blood pressure can be regulated. And your textbook provides quite a lot of information on this. I want to avoid just repeating it, so I thought that let's approach this thing in a little different manner. Do you remember our diagram of the homeostatic loop mechanism? It looks something like this. And as I said at the time, we keep returning to this concept when trying to understand body processes. If you have forgotten the basic concept, I have again added a link to the end of this video where you can access the explanation of this. But this should be familiar, so let's carry on. So what I thought that we will do is to review the ways how blood pressure is regulated in a short term with this diagram. Let's give it a go. So, our stimulus is a change in the blood pressure, and we have the set point for normal blood pressure set as somewhere around 120/90 or so. Now, we have something known as baroreceptor reflex. It is one of body's homeostatic mechanisms to maintain the blood pressure at constant levels, and it can act through the following three mechanisms as receptors. So we have receptors at carotid sinuses. These are the slightly dilated area where the common carotid artery divides in the neck. And then we have receptors at the aortic arch. And finally, at the large arteries, especially at the neck and thorax. Note that we also have chemoreceptors that regulate the blood chemistry, such as the carbon dioxide concentration, oxygen saturation, and blood pH. These receptors are located at the aortic arch and large arteries of the neck. Well, these pass messages to the control center, which is typically the brain, and in particular, the medulla oblongata. There is in this case. This is where the blood pressure is controlled from. Remember that many of these vital functions were housed in the brainstem, one of the early structures to form both evolutionarily and in development of an individual, and one of the most protected areas too. From medulla, the messages are forwarded to other levels, for example, to hypothalamus and cortex. So, how do we act on the high blood pressure? Well, we can do medication, treat the cause, or utilize vasodilation or constriction. And I should also add, although I did not include it in this figure, the role of hormones, for example, epi and non-epinephrine, ADH and angiotensin II. So this was a brief summary of our short-term regulation of the blood pressure. Let's have a look at the long-term regulation. This happens largely through kidneys by changing the blood volume. This in turn will have an effect to the blood pressure. So two things that we might wish to do. If there is too high blood pressure due to too much volume, we might rectify this by eliminating some, by getting rid of it through peeing. Or if there is too low blood pressure resulting from low blood volume, we could start to conserve water in our body in order to maintain the volume and through that the blood pressure. Your textbook offers a nice diagram which you can see here. Study it on your own time. The left side shows a direct mechanism, while on the right we have a little more complex indirect mechanism. This is also known as renin-angiotensin-aldosterone mechanism. So, I was thinking of what to say as a summary of all this. And I guess that this does it fairly well. Note that we want high enough, but not too high blood pressure. So, this is where we will finish this lecture video, and in our next video we will continue our discussion of blood pressure and its effects.